Welcome back, dear viewers. Pediatric dentists are specially trained to make dental visits more comfortable and anxiety-free for children. They use various techniques to help alleviate fear, such as creating a friendly environment, using child-friendly language, and incorporating fun, engaging activities. Many pediatric dentists employ distraction techniques such as games or videos to divert attention during procedures. They also educate children about dental health through interactive methods, building trust and positive associations. Now, dear viewers, let's all welcome Dr. Ghabriss, pediatric dentist. Good morning, doctor.
Good morning.
We're happy to have you here with us today.
Thank you for having me. It's a pleasure. Thank you so much.
It's our pleasure, doctor. Starting off, can you please tell us or share with us some techniques that you use and found effective in calming anxious children coming into the dentist?
Yeah, thank you for actually talking about this subject, because it's very important to know that the behavior management techniques and the behavior management is one of the most important issues in pediatric dentistry, because it's actually directly related to the success of the treatment. There is a big range of techniques. Actually, let's not go into saying or talking about that in medical way. Let's be more practical, and let's take an example for a child coming to my clinic for the first time. So the first thing we need to do is that we need to know the name of the patient. We need to talk to the patient as for example, if I have a patient, his name is Adam, coming to my clinic, the patient comes inside, I need to welcome him with his name, because he's not someone, he has a name. Definitely. Starting from these very simple techniques, they are magical. Let's say Adam comes inside, I go, hello Adam, how are you? It's nice to have you, it's nice to meet you. The child actually is impressed, and I can hear them murmur, and I can hear them like talk to the parents, how come she knows my name? This technique actually gives the child like the feeling of being more comfortable. I mean, he's in a place someone knows him, and now we move to another techniques, like we need to talk, open a conversation with the child. We shouldn't go directly to talk about dentistry, about the checkup. We need to open a subject, we need to like open a dialogue to assess the child's level of comprehension, level of development, his maturity, and we might be talking about something like for example, if there's a character in his shirt, I would be going, wow, I love your shirt, what's that character, can you tell me more about it? And then we move back to the teeth, and then I go like, wow, you have a nice smile, do you mind if we count the teeth? We go into now back to the teeth. I give him a mirror. For example, a mirror is a technique, because sometimes kids are very scared of the unknown. So whenever you give him a mirror, you're telling him you're safe, you're in control, you can see everything.
Definitely.
And before we go into the treatment, we go in the tell, show, and do. You never just ask the child to open the mouth.
Definitely.
You have to explain to him what's going to happen. You have to show him what's happening, and then you need to give him positive reinforcement. Well done, you're doing great, this is amazing, I can't do this without you.
Very beautiful.
With lots of other things. Techniques are, I mean, the range is very wide.
So many techniques.
Yeah, so
very
many
beautiful
techniques,
the way you said it here, definitely. And the technique by mentioning the kid's name is actually very special, and as you mentioned, will give the child a sense of comfort coming into the dentist.
Exactly.
And doctor, what role does communication play in interacting with, let's say, children or young patients?
Well, talking about communication, communication is the cornerstone of pediatric dentistry. This is what makes us special, the pediatric dentists. We have these communication skills. We need to know how to communicate with the kids, because if you don't know how to communicate, if you cannot communicate with them, definitely whatever technique, whatever, you cannot manage the behavior of the child. But this also depends not only on the dentist, it depends also on the child itself, the age of the child, because some children are too young, they don't have the communication skills, the intellectual development is not so mature. So communication is the cornerstone. If you communicate, you can treat. If you cannot, then you cannot treat.
Especially starting off with calling the child by his name and talking to him, as you mentioned, mentioned, to make him feel more at ease in the
there
dentist?
are lots of techniques. I mean, not only calling the name of the child. You have to go with positive reinforcement. You have to go for distraction. Sometimes you have to distract the child. You have to go for let's say a reward prize at the end of the session as well.
Of course, doctor. Since you mentioned distraction, actually that was my upcoming question. How does distraction play a role to ease a child, you know, ease his fear coming into the dentist?
This is true. Distraction, it plays a big role actually in the behavior management. Why? Because sometimes you need to withdraw the attention.
Definitely.
I know that now I'm going to perform something uncomfortable for the child. I need to be ready with my body language, facial expressions, tone of voice, and I need to go into like, let's say, ask the child if he can count for me. We can go with sounds. We can ask him to watch TV. We can talk about the episode of the cartoon we're watching. We need to distract the child in order to perform something we need to do. But at the same time, we have to be very clear with the child, very use very simple language, and and we have to be as well. We have to be honest along with the distraction. So we're not distracting him actually to hurt him. We're distracting him only because we want to perform something that might be, uncomfortable for him.
That is true, doctor. As you mentioned here, with so many techniques, of course. And can you also explain to us how do you create actually a child-friendly environment in your dental clinic?
Yeah, the child-friendly environment actually starts from the time of booking of the appointment. For me, for example, I make sure that the appointments do not overlap. I mean, there should be a gap between the appointments. I'm always worried that some negative experience of a child on the dental chair might be heard or transmitted to the other child waiting in the waiting area. So I make sure that there is no overlap in the appointments, and then some pediatric dentists would go for making a play area in the waiting area. For me, I go for something else. I make sure that the child do not wait in the waiting area, because you know, it's even for adults, if you wait, this might increase the levels of anxiety and stress. So I would like to bring him straight into my clinic, and inside the clinic it's going to be colorful with stickers. They have the option to choose the color of the bib, the suction. We have books, we have toys, we have stories, we have TV. This is all, I mean, it's friendly for the child, as well as the communication and behavior, body language, facial expressions of the pediatric dentist and his assistant.
And of course, that is true. So anything that puts the child at ease and comfort being in the dental clinic, of course, doctor. And can you tell us what are some common fears that children come into the dentist carrying them, and how do you address them and deal with these fears?
Yeah, actually, in general, let's say it's not only for the kids, even for you and me and for everyone. You are scared of the unknown. What's going to happen next? What is the doctor going to do? Is he going to pull my tooth? What is he going to do? Is he going to hurt me? What is he going to use? So usually we are scared of the unknown and the unfamiliar environment. Now, once we put the child, he's familiar with the place, he's familiar with you, he's starting to build this relation, the trust relation. This is the first step to a good management of the behavior. Mainly kids are scared, unfortunately, of the injections, because in our culture, as you know, the mommies and the daddies, when they want to like threaten or punish the child because he did something bad, they tell him, I'm going to take you to the doctor to give you an injection.
That's a threat.
Yes, and when it's time to give the injection, then this is related to something bad. They're scared of injections. Of course, we do have injections, but we give them a different terminology. It's more like simple, easy. We don't use red flag words like injection and pulling out. We do everything with simple language. Exactly. Yes, they're scared also. Sometimes they're scared of the loud sounds. This is why we always ask our assistants to be on silent mode while opening opening the drawers, nothing should be dropped on the floor, no sudden sounds, even the sound of the suction, because you know that the suction in the yeah, it can be scary, of course. So we go by like normalizing the sound. I go like, have you ever heard the vacuum cleaner when mommy's cleaning the carpet? Have you ever heard the hair dryer? And I'm gonna let you listen to something similar to that, and then I get this suction, which I call in my clinic the magic straw, because they're scared of it. So what we do is we try to show them that that what we're using is something.
Normalizing it.
We're normalizing things. And even for the suction, we might be asking the child to hold the suction because it's so magical, and it's gonna. We put water in the cup, and then abracadabra, there's no water, and then we ask the child to like try to do this magic in his mouth. So usually the sounds, the injection, they're also scared of pulling out teeth.
Yes.
But with the right way of communication, they're gonna do it happily and easily.
Yes, that is true. Actually, doctor, with all of the techniques you mentioned, and since you mentioned parents, the moms and dads, would like to know how important is it to involve actually parents in the process of making dental visits less scary for their child?
Well, they play exactly an important role as the pediatric dentist himself, because actually the behavior management starts at home with the parents. The first and most important thing is that the parents should not transmit any negative experience they had in the dentist to their children. This is very important. Do not talk about your dental experience in front of the kids, even if you think that they're playing, but they're around you. You shouldn't be discussing these things in front of them. Be very honest, be very clear. Tell them that we're going to the dentist, and tell them why we're going, using, as I said, simple words. Do not use red flag words. Keep the things for the dentist to discuss. It's very important that even the parents start the oral hygiene habits at early ages, start going to the dentist with routine checkups every 6 months, and not necessarily when the child is in pain. He should be going to the dentist every 6 months, starting from the age of 1. This is going to make the place familiar and the doctor familiar to the dentist, and this will help us in later on the behavior management.
Definitely, doctor, amazing the way you said it here. And can you also discuss with us the use of positive reinforcement to encourage good dental habits in children?
Actually, who doesn't like to be praised? Yes. I mean, if you do something nice, you would always like to be praised. So of course, kids do like to be praised as well. Of course, we need to like encourage them to clean their teeth at home, to brush by modeling. For example, as a mother, I need to brush and floss my teeth in front of my children every day in order to like positively reinforce them, positively encourage them to do that. I'm a model for them. So modeling starts from home, from the parents themselves. If they're brushing, they're taking care. We have to be like, we're so proud of you. You're so amazing. You're doing a great job. And exactly, even in the clinic, when the child is cleaning, he doesn't have cavities and all this, we have to positively reinforce him. So this depends on how the parents are actually dealing with the kid at home, how they're encouraging him. It shouldn't be like something he has to do, like, if you don't do that, I'm going to do this and that. It should be something they have to do out willingly and not by pressure.
Out of love.
Yes, exactly.
Definitely.
This is a routine, actually. They're gonna get used to it. It's a routine.
Yes, that is true. Actually, doctor, here the way you said it, being praising the children when doing, let's say, brushing their teeth or doing small chores that, let's say, would make them very happy. Hearing these words from their parents,
of course,
that you did a good job, that will continue. Let them, continue doing more and more of these nice behaviors.
But we have to also add something here. If for a reason the child came to the clinic and he had a cavity, we shouldn't go put all the blame on the child and you were not taking care properly. Of course, the child has to know the consequences of not brushing and of not taking care of the oral hygiene, but at the same time, we cannot go like blaming the child. We can tell him, well, maybe there was a naughty germ that stayed here. It caused this cavity, but for next time, we need to be more careful. Don't let her trick you, and this way.
That is true. We would like to thank you, Dr. Nahid, for being here with us in Good Morning Kuwait. Kuwait. Thank you for your informative details. And dear viewers, we would like to thank Dr. Nahid Ghabriss, a pediatric dentist. This brings us, dear viewers, to the end of today's episode. We hope you enjoyed today's episode with various segments. Now, goodbye for now. We'll see you later.